Dr. Karan Kukreja, Orthopaedic Surgeon for Manipal Hospital Whitefield. Another cause of unexplained knee pain in the middle-aged person would be a meniscus tear. Meniscus tears, especially tears of the medial meniscus, are common. Most typically occur after an injury, but sometimes can occur without any obvious injury or with a very minor twisting injury that can easily be missed. Sometimes there can be a pop sound or an acute onset of pain, but sometimes the pain is very insidious and can slowly progress. So this means that any vague knee pains, which is unexplained by other causes, can be because of a meniscus tear. Meniscus tears can be of many types. The common type involving middle-aged people without any major injury are degenerative tears, and they can have very mild vague symptoms. Another type of meniscus tear is a meniscus root tear, which may also start off with as a degenerative tear, but then can cause sudden worsening, and once the tear becomes complete, the meniscus tear causes severe loss of joint mechanics and severe pain and inability to walk. Sometimes the pain can be almost as severe as a fracture. Since the mechanics of the knee are severely affected in a meniscus root tear, quite often by the time a person comes to us with typical symptoms, there is already an extensive amount of joint damage developing. And it is imperative that we treat this meniscus root tears as early as possible to either prevent this damage from happening or to reverse the damage as much as possible. The untreated medial meniscus root tears are a very common cause of early knee arthritis. And this is one of the reasons why we see an increasing trend of knee replacement surgeries in the age group of 50 to 55 years. To summarize, knee pain in the middle-age group can have two common causes, one of which is patellofemoral pain and the other is meniscus tears. Both of these can cause vague pains without any injury and sometimes can become very severe, causing major disability. It is important to identify both these problems with proper detailed clinical evaluation, X-rays and an MRI scan. And by identifying these problems early, both of them can be picked up at a time when it is easily reversible with proper rehab and sometimes surgery, and can result in a good long-term outcome. And this is one of the ways to ensure that the knee joint lasts for many years together.